This video will assist you with printing out a medication voucher provided by your health department. We created this medication voucher system to help you receive the medication that is right for you as quickly as possible. To print your voucher, you must have access to a computer and a printer. If you do not have a computer and a printer available, contact your local health department for assistance. After opening your internet browser, follow the link to the medication voucher website provided by the health department. Please note that the health department website may look slightly different than the one shown. The medication voucher website will ask a series of questions to determine which medication should be dispensed. You will need to go through these steps for each member of your family so that each family member has their own form. After one form has been completed, the website will allow you to fill out additional forms. First, fill in your personal information. If filling out the form for a family or household member, you should fill in their personal information. You will be asked to enter in your address and phone number in case the health department needs to send you additional health or safety information. Enter your first and last name, address, city, state, zip code, telephone number, date of birth, weight, and gender. The weight is important for prescribing to individuals who weigh less than 90 pounds. If you don't have a street address, enter the words "no address" in the address field. Then enter your city, state, and zip code. If you don't have a phone number, enter all number 5s in the phone number field. Next, fill in your medical information. Question 1 asks if you are allergic to cycline drugs. This category includes doxycycline, tetracycline, dimeclocycline, and minocycline. On the right side of the screen, you'll see the different brand names associated with each drug. Only answer yes if a medical professional has said that you are allergic or if you have had a life-threatening allergic reaction to one of these medications in the past. A life-threatening allergic reaction can include skin rash, hives, itching, wheezing, shortness of breath, or trouble breathing, and/or swelling of the face, lips, or throat. If you have had one or more of these symptoms when taking one of these medications, check the yes box. If you answered yes, an additional question will appear. Question 1A asks if you experienced respiratory breathing or cardiac heart arrest after taking this medication. Cardiac arrest is also known as a heart attack. Answer yes if either of these reactions occurred after taking a cycline medication. If you have not had a life-threatening allergic reaction to cycline drugs and answered no for question 1, Question 1A will not appear, and you can go directly to Question 2. Question 2 asks if you are allergic to floxacin drugs. This category includes ciprofloxacin, gadifloxacin, levofloxacin, moxifloxacin, nattifloxacin, norfloxacin, and ofloxacin. On the right side of the screen, you'll see the different brand names associated with each drug. Only answer yes if a medical professional has said you are allergic or you have had a life-threatening allergic reaction to one of these medications in the past. If you have had one or more of these symptoms when taking one of these medications, check the yes box. If you answer yes, an additional question will appear. Question 2A asks if you experience respiratory, breathing, or cardiac heart arrest after taking this medication. Cardiac arrest is also known as a heart attack. Answer yes if either of these reactions occurred after taking a floxacin medication. If you have not had a life-threatening allergic reaction to floxacin drugs and answered no to question 2, question 2A will not appear, and you can go directly to question 3. Question 3 asks if you have had a seizure disorder or epilepsy. If you have had seizure-like symptoms while you were really sick and had a high fever, but have not experienced these symptoms after the age of 17, you can safely answer no to this question. Question 4 asks if you are currently taking tizanidine, brand name Xanaflex. Only answer yes if you are taking the medicine now. Answer no if you have only taken it in the past. Question 5 asks if you have difficulty taking pills. If you have difficulty swallowing pills, mark yes, and you will receive a medication that can be crushed and taken by spoon after being mixed with pudding or applesauce. Question 6 asks if you have renal or kidney disease. Answer yes if you have severe kidney disease or are on dialysis. Question 7 asks if you are allergic to amoxicillin or other penicillin drugs. Medications in this category include penicillin G, penicillin V, penicillin VK, nafcillin, oxacillin, cloxacillin, dicloxacillin, ampicillin, amoxicillin, bacampicillin, carbonicillin indonyl, ticaracillin, meslocillin, piperacillin. Only answer yes if a medical professional has said you are allergic or if you have had a life-threatening allergic reaction to one of these medicines in the past. If you have had one or more of these symptoms when taking one of these medications, check the yes box. If you marked female for gender at the beginning of the form, question 8 will appear. If you are pregnant, check the yes box. At the bottom of the online medication screening form, the form reads, I have been offered a copy of the disease information sheet. Disease information sheet is underlined. Click on the underlined words and your browser will open a new window containing an informational sheet about the disease. You can read this information on the screen or print a copy for your reference. Once you have reviewed the disease information sheet, if you agree to receive medications to help prevent the disease, click the box next to Agree and then click Next. The next screen will contain the voucher with the information you filled out on the previous screen. The type of medication you should receive is printed at the top of the form. Verify that the personal and health information is correct and then print the voucher. Click the box that says Print in the upper right corner of the screen. Once the voucher is printed, read the paragraph under the health history. If you agree with the paragraph, sign and date the form. If authorized to fill out a form for a family or household member, you may sign for them and bring the voucher to a local dispensing site to pick up their medication. Depending on the answers to the questions, your voucher may say, "Do not dispense medication" at the top. If your voucher says this at the top, it just means that you should be prescribed a medication other than doxycycline or ciprofloxacin. Individuals with this type of voucher should contact their healthcare provider to receive an alternative medication. If you have multiple family members who are in need of medication, you need to fill out and print this form for each family member. Click the Back button on your browser to go back to the screen with the questions. You may have to hit the Back button twice. Hit the Clear Form button in the bottom right, then repeat this process for each of your immediate family members. Thank you for watching these instructions provided by the Johnson County Department of Health and Environment.